We're doing a review of skeletal muscles looking at the posterior side of the arm. My name is Brad. I've been teaching anatomy for about 24 years now. I also add a study guide to this if you want to click on it later just to review some of the muscles. What I'll do is I'll show you these muscles and we'll go through them, but then as I'm doing them, see if you can identify them yourselves. What's difficult about anatomy is that you'll have charts, you'll have models, you have different pictures to look at, and they all look a little different. No different than I look, different than you, but I'm still the same human species. So as we go through these, try to practice the words and the locations and associated with them. So we'll go through them. I'll show you the key, and then we'll get into the origin, insertion, and action. Remember, the origin insertions are our attachment points. The origin is the point of less movement. The insertion is the point of more movement, and the action is the prime movement or agonist movement that it does. So let's take a look at this. As I start to look at some of our rotator cuff muscles for the shoulder, looking at number one, remember this is above the spine of the scapula, so we call it supraspinatus muscle. As I go below it, infraspinatus muscle. If we were on the anterior side, we would see subscapularis muscle. And then as I go below, I have teres major and teres minor. So the teres minor is superior, teres major is on bottom. So these 1, 2, and 4 are part of our rotator cuff. So as we then expand to our primary multi-pennant muscle, the deltoid. The deltoid is one of our stronger muscles, so I can help to move the shoulder. I come down distally from the shoulder, and we learn on the posterior side the triceps brachii. So tri meaning three heads of the arm on the posterior side, and that's 6, 7, and 8. Typically, we often see the 7 and 8 when people are working out and they're trying to develop the muscle, and we call that horseshoe because we're looking at two separate heads of the triceps brachii. So I have triceps brachii medial head because this is a right arm in the anatomical position. Medial head tends to be the smaller ones on models and charts. On this picture, it's relatively larger. Triceps brachii medial head, the one that comes down the center, long head, and then lateral head from anatomical position. So lateral, long, medial head. As we go distal from the triceps brachii, and I come down from where I'd have brachialis along the humerus, then it turns into brachioradialis, which is number 9 here, brachioradialis, because coming from the arm to the radial side. And then I have extensor carpi radialis longus. You may be able to see a brevis, extensor carpi radialis brevis underneath there. So brachioradialis, extensor carpi radialis longus, because I'm extending my carpes or my wrist on the radial side. And then I come down to number 11 here to where it has all of these tendons that are going to all my digits to extend the digits. So I'm extending my digits. So brachioradialis, extensor carpi radialis longus, and then all of number 11 is extensor digitorum. Right next to it, that skinny one that's going to go to my pinky, extensor digiti minimi, extensor digiti minimi. And then I have extensor carpi ulnaris, extensor carpi ulnaris, and then I start to flip around and I see 13 is flexor carpi ulnaris. So flexor carpi ulnaris, extensor carpi ulnaris, extensor digiti minimi, and then I get into extensor digitorum. Up top, right as I get behind the elbow, at the base of all of my triceps brachii, number 12 is Anconeus. So see if you got those as I was going through them. Now let me show you the key for this, just so you can use this and stop the video when you want to go through them. So a quick review: supraspinatus, infraspinatus, teres major, teres minor, deltoid, my 3 triceps brachii, medial head, long head, lateral head. As I come down from brachialis, it would be here, brachioradialis, extensor carpi radialis longus, extensor digitorum, and then I come up to Anconeus, and I have extensor digiti minimi, and then my extensor carpi ulnaris, starting to flip to the anterior side, flexor carpi ulnaris. Now we get into origin, insertion, and actions. Can you remember them? And I try to break them down as simple as possible. To me, the best way to do it is just organize them into groups. So in this case, I do groups of 4. And OIAs can be difficult. I did a previous video on trying to identify them, but it's a challenge. So what I recommend is putting them in groups. So I did Supraspinatus, Infraspinatus, Teres major, Teres minor. And I'll start to group them together because you're using some of the same bones, just different landmarks. But I see supraspinatus because it's part of supraspinous fossa versus infraspinatus, infraspinous fossa. So there's some little things that if you remember your terminology from skeletal system, it's not too bad. Both have greater tubercle of the humerus. So I try to capture that in my mind. And what are we doing? We're taking away from the shoulder, abducting versus then a lateral rotation. But I try to remember overall movement of the shoulder because this is part of my rotator cuff. Abduct, take away, but a lateral rotation with infraspinatus as I get lower. Teres minor and teres major. Teres major as I go down the side of the scapula. Well, remember we looked at intertrabecular sulcus of the humerus. And then what are we doing? We're moving now the shoulder from a medial side or extending it because we did a lateral for infraspinatus. Teres minor, the lateral border, versus we did inferior angle for teres major. We see greater tubercle of the humerus. Well, that repeats when we talk about infraspinatus and supraspinatus. So this is where I try to group them together the best you can. And then it repeats with lateral rotation and now adduction of teres minor because it's helped again with those rotator cuffs. When I get into the rest of my arm, deltoid, where is it attaching? Specifically at the chromion and then the scapular spine. So at the clavicle and scapula. So as I come up over the top, that makes sense. Deltoid tuberosity, remember on the humerus, it comes down and converges and points. And then what do we do? It's overall movement of the shoulder at the humerus. So as we get all that good movement of flexion, medial lateral rotation. Triceps brachii, extend the elbow versus biceps brachii is flex the elbow. And so where am I attaching this? On the posterior side of the humerus and then at the olecranon of the ulna. Where as we look at biceps brachii, it attaches to the radial tuberosity of the radius. So then I try to compare the ones that are agonists versus antagonists. Triceps brachii, the long head, infraglenoid tubercle, but back to the olecranon of the ulna. So then you could start to see this repeats, olecranon of the ulna and then elbow extension. So try to group these together the best you can. When we look at the rest of them, when we go through 9 through 15, we're moving on to Brachioradialis and extending from the brachium, the lower or distal part of the arm, to go over to the radial side, to the radial styloid process. How do we use this? Extension of the elbow. So it helps with our triceps brachii. Extensor carpi radialis longus. We're going over to the humerus and then our second metacarpal. Our second metacarpal is where we start to name them 1, 2, 3, 4, and 5. And what are we trying to do? Extend or abduct the wrist. Okay. Extensor digitorum, our lateral epicondyle. Remember, that's the smaller piece, the medial epicondyle. The lateral epicondyle is the larger piece, that medial epicondyle is the larger piece. Where are we going? We're trying to extend our digits. So 2 to 5, to extend those digits. The thumb has its own muscles to work, and we'll talk about that in another video. And what are we trying to do? We're extending at the fingers and the wrist. Anconeus is coming from the epicondyle of the humerus, again on the lateral side. So extensor digitorum and Anconeus do the same thing. What are we trying to do? Extend the elbow again. So we're repeating this. So we're extending the elbow just like when we talked about triceps brachii. As I come over to the flexor side, we move flexor carpi ulnaris, but remember now we're trying to flex the wrist. Where are we doing this? Pisiform hamate and our fifth metacarpal. So as we learn our wrist bones, it's important to remember that language moving forward because it's going to originate now at the medial epicondyle, and where we saw lateral epicondyle, extensor digitorum. So I try to put those together based on their opposite action. Extensor carpi ulnaris, we see lateral epicondyle again. So they're showing up at the same spots. It's just now the dorsal side of it. But I try to remember extensor digitorum and my ulnaris on the extensor side is both coming from that lateral epicondyle. But now we're going to the fifth metacarpal. Remember, our fifth metacarpal is on the pinky side because we're extending on the ulnar side. And what are we trying to do? Extend the wrist. And then lastly, extensor digiti minimi. Well, we said our extensor digitorum goes 2 to 5 phalanges. Extensor digiti minimi is going from my number 5 proximal phalange. And what are we trying to do? Extend the phalange at number 5. So when we look at digitorum, 2 to 5, extensor digiti minimi, just that small little one to do the wrist at number 5 phalange. So this is a quick review as we're going through these. What I realize is sometimes it's nice just to listen to these and then have active recall later, teach it to somebody else, try to practice them visually and look at them on pictures, but then group them together in different sides, like flexor side, extensor side, the rotator cuff, at the shoulder. Try to put the ones that are similar together and remember they're based on how they move, where they have that action to give us that insertion and origin. This is muscles of the posterior arm.